Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Blood pressure during anesthesia is monitored by. Actually, blood pressure can be monitored by two ways. One, we have continuous blood pressure monitoring, which is invasive blood pressure monitoring. Then we have non-invasive blood pressure monitoring. Non-invasive blood pressure is monitored for every 5 minutes, whereas invasive blood pressure is monitored continuously, and this invasive blood pressure is monitored by cannulation of artery, and most common artery which is cannulated is radial artery is cannulated. By cannulation of radial artery we can measure the BP during anesthesia. But the main before cannulating the radial artery we should check for modified Allen's test, and then we can cannulate the radial artery.
thank you and thank you for watching.